So hello everyone. Today I'm going to present to you my policy brief on containment of COVID-19 in Morocco. In this little presentation, we will first go through the objectives of this policy brief, the current state initiatives and the current situation with a small timeline. And then we will see the policy recommendations regarding containment to avoid a second wave outbreak, and then we will finalize with some main takeaways. So the objectives of this policy brief is to assess how Morocco has dealt with the COVID-19 crisis, to expose the policy on containment and prevention of the virus spread, and to finally show the recommendations that should be implemented by the Moroccan government. So to show you a small timeline of the evolution of the situation throughout Morocco during the pandemic, on March 13th, flights and ferries communicating with Spain, Algeria, France, and Italy have been suspended. The next day, the same policy was announced for other 25 countries. On March 15th, all international flights have been suspended. And on March 19th, a state of medical emergency was declared, with everything closing from universities, schools, shops, malls. Everything was closed besides the essential stores as supermarkets or pharmaceuticals. And as of what is happening recently, on November 19th, the African continent hit 2 million coronavirus cases. And today in Morocco, 70 infections per 100,000 people are reported on the last 7 days. So what are the policy recommendations on containment of COVID-19? We'll see them briefly and then go more in detail through them. So the first one would be to expand the testing capacity. The second one would be to implement a vaccination and immunization campaign. The third one would be to close regional borders. Fourth one would be to improve contact tracing. And finally, the last one would be to increase the ICU's admission rate in Morocco hospitals. So regarding the expansion of the testing capacity, right now, there is a really low number of COVID tests carried out in Morocco. To give some numbers, there are 0.55 tests per 1,000 effectuated on a daily basis, while comparing to Spain, for example, this number is of 2.75. So therefore, there is this need to avoid testing only travelers, patients that are already in the hospitals or close contacts. It is important to implement a massive testing because if it's not the case, a significant number of cases are still missed. And to expand this testing capacity, it's important to purchase more tests and to promote them across the population. Second important recommendation would be the vaccination and immunization campaign. Right now, it is quite a favorable time for Morocco because there is the possibility of receiving vaccines before the strike of a second outbreak. Morocco is actually expected to receive 10 million doses by December. That is because they have been offering to China, the country that will sell them these vaccines, to participate to the testing phase. So by December, they should receive a few doses, and the frontline workers in the health sector and security forces should be the first ones to receive, continuing then with elderly people that have critical health conditions, and children, and finally young adults. The closing of regional borders is also important to contain the virus. Across Morocco, the cities are not affected by the virus in an equal way, and there is an important gap between industrial and non-industrial regions. So to maintain this border closed is key at the moment, especially because there are not enough tests carried out and the vaccine has not arrived yet. And also especially because these zones that are considered safer regarding the virus are usually non-industrial zones that don't have the ability to cope with the virus, don't have the hospitals required and the resources that are necessary for that. To improve contact tracing is another recommendation that is really important. Right now in Morocco, the contact tracing is really slow, and there has been the intention of creating an app that would be used mainstream and that will enable traceability. However, it hasn't been a success. Therefore, it's important to improve this traceability by making sure that robust and well-trained health workforce are in charge of this task. These health workers should be cooperative and have skills as interpersonal or communication skills that will lead to build and maintain trust with these patients in order for them to communicate who is potentially infected by the virus. As of right now in Morocco, usually people wait 4 days to get tested, and even 4 days or more to get the result, which is really big number compared to the European countries that wait way less. Finally, fifth recommendation would be to increase the ICU's admission rate. This would be a long-term proposal, as it is not possible to create more doctors or nurses really quickly, but in Morocco there is a lack of a health workforce, and the health system is quite weak. Actually, patients are usually treated only when symptoms have worsened because there are not enough spaces in the ICUs. So it's important to, in the long term, construct more hospitals and to provide more funds for med schools in order to create this to create this workforce of nurses and doctors. So what would be the conclusions and some main takeaways? Right now, Morocco is in the top 3 countries worst impacted by the virus in the region, in Africa and the North African part of the continent. So it's important to act quickly. Although Morocco is getting better in the last few weeks, and some numbers are decreasing in terms of infected people. Therefore, to take the necessary measures to prevent from a second outbreak can soften the probabilities of a new way, and can be key to do the things right, especially because they can take examples of the neighboring European countries that are right now facing this second wave and trying to curb the contagion. So it can be an advantage for Morocco to react in a even more efficient and quick manner. And finally, there are important hopes remaining on an upcoming vaccine that should relieve the current epidemiological scenario. As explained before, China should sell 10 million doses by December. And this can make a huge difference in how the virus can still be spread across the kingdom. So hopefully this will happen soon and the situation will get better regarding the COVID-19. Thank you very much for your attention, and I hope you enjoyed this presentation.